My name is Dr. Sanda Moldovan, and I'm a periodontist and certified nutritionist with two practices, one in LA and one in New York City. And I really love to work on full mouth rehabilitation cases. I did my training at UCLA School of Dentistry, and Dr. Sasha Jovanovic was one of my mentors. But the nutrition interest really started a few years after that, in about 2006. I just didn't know why some patients heal perfectly fine, and after performing the exact same procedure on someone else, he or she would heal poorly. So I didn't know where that came from. And I started looking into nutrition for my own personal reasons. And then I said, wait a minute, does this have anything to do with healing? And as in my residency, I actually only had one semester of nutritional education. And I really didn't know anything. So I became a certified nutritionist through CBNS, which is one of the highest nutritional educations available today. And I learned a lot of how to help my patients with their healing post-surgically. Integrative nutrition has really changed the way I practice, because when somebody walks in through the door, I can look at them and really assess their wellness status before they even fill out their medical history. I can tell by the way their skin looks whether or not they're dehydrated. If they have dark circles under the eyes, I know that they have a nutritional deficiency or even possibly food allergies. So I now incorporate nutrition in almost every single one of my treatments, whether it's assessing vitamin D levels for proper healing or giving them nutritional supplements before and after the procedure. It has really changed the way my patients heal. And I really want to optimize the way they heal so that they have less pain and less swelling. My patients are not really used to a dentist talking to them about nutrition, but they have welcomed it. And they start asking me different questions. They actually follow my blog now to find out what's new in the nutritional world. And not only I improve their healing, but they usually have a better quality of life. And they incorporate some of the nutritional changes forever. So I think that us as a dental community have an amazing opportunity to teach our patients about nutrition, because we could really change their lives and create that relationship with our patients that will last forever. I'm in the process of writing a book called Healing for a Pill-Popping Nation, which will be out next year, in which I want to help our patients as well as our dental community learn about nutrition and how to gear some of these personalized plans to improve healing. In the nutrition world today, we have a lot of advancements and research about different factors, but not only nutritional deficiencies, but the electrical component of the cells. So one of the newer equipment that I've been working with is called My Health from Nest Health, and it works on microcurrent and pulsed electromagnetic field. This is an area that's hot right now, and a lot of doctors are using this for healing, not only just through surgery, but also for like arthritis, TMJ, and we're going to be seeing a lot more studies coming out of the importance of microcurrent and pulsed electromagnetic field. Practicing in Southern California, I have a lot of patients that are interested in the natural way or the natural approach to surgery. So a lot of my patients don't even want to take ibuprofen. The good news is we have a great alternative, such as enzymes, bromelain and quercetin, for example, which I regularly use, that has been studied quite extensively to show that it works as good, if not better, than ibuprofen. And it is an extract from the pineapple stem and is generally safe for most everyone. And I often think is, what kind of advice can I give a dentist who is just starting looking at nutrition? So one great conference that we have is through American College of Nutrition, where you could learn a lot of things, even through webinars. But also here at Guide, I can bring you a lot of nutritional advice to get you started with just the basics, which will help improve your practice. I started being a regular on the doctor's TV show about 5 years ago. And when I first started, I didn't know they were going to show such details of our surgery. But we started with simple wisdom tooth extraction. I even did a frenectomy, some periodontal surgery. We talked about flossing, but my latest procedure was quite extensive. I actually did an all-on-4 treatment concept for a maxilla as well as lower rehabilitation. So it was really full mouth rehabilitation, and they've shown quite a lot of detail about it, even me using a rongeur to do ostectomy. They've showed implant placement. So people today really want to watch that. They want to see what's happening. The patients want to get involved in their treatment and see what their options are. And more than ever, patients are self-referring to themselves to us instead of going through a referring doctor. My mission is to really educate not only the general public, but also our dental community on using nutritional plans and nutritional interventions to improve health and wellness and healing. And I would like to do that in any avenue possible. So, for example, TV, media such as social media, Twitter, radio. I want to get the message out that you as a patient, if you're going to go through surgery, there's something you can do about it to help your healing. It is not just dependent on your doctor. You should take healing into your own hands. Dental treatment is really changing all over the world, but the problem we're really facing today is a global epidemic of obesity and chronic inflammation. And that is going to affect our surgical results. I already see it happening in my practice. People who are suffering from metabolic syndrome or diabetes, which is on the rise, really have more swelling, more inflammation, more implant failures. So this is a great opportunity for us to not only influence healing, but really change our patients' lives. What's very important in my life outside of dentistry is to keep a balanced life. That is so important, I think, for everyone. And it's very easy even for me to fall into the trap of working too much. I have to keep up with nutritional news, go to nutritional conferences, then go to dental conferences. But really, I love to de-stress. I love to be outdoors, to hike, to swim, to go diving, to travel. And I love to spend time in my kitchen. Being a nutritionist, I love to prepare nice and delicious meals. And I think it's all about balance. Meditation, relaxation, working hard, and really having fun. Thank you. So as I say, just as the eyes are the windows to your soul, the mouth is a gateway into your health.
For more education programs, visit the Guide Institute at www.guidedental.com.